Hi, welcome to Longevity and Health, Tapping the Chi. My name is Terry, and today I'm going to talk about eye health with a couple of added herbs than I did last time. So I'm going to show them to you, and then I'm going to have my cup of tea, and we're going to talk about how the herbs help. So what I have here in the plate is a chrysanthemum flower. Chrysanthemum flower, okay? That's like the bud. And then I also have these very, very fine blue. They're actually called bilberry. So it's a tiny little bilberry. And then, of course, you have your famous goji berry. So the bilberry is really what I'm adding in this video. And the other thing is nettle. Now, cut nettle, it's like the leaves. The actual plant, it's really interesting because the plant has these tiny little needles, like a nettle. And you have to be careful if you pick it, that you don't prick yourself. And we're going to go into the herbs now. So the goji berry, which I've gone over before, and I'm going to be very general and basic in this, so I'm not going to get into actually all the specific scientific, but there are. The goji berry helps with age-related macular degeneration, and it actually really helps with the macular. It's an antioxidant. It helps to nourish the vision, and it helps with dry eyes. So it helps with the back of the eye. The macula is a central part in the back. Chrysanthemum flower helps with the conjunctive surface. So it helps with the eyelids. It's a cooling, anti-inflammatory, allergies, eye strain. Sometimes your eyelids get swollen and puffy. The bilberry is very interesting. It helps with the retina, again, back of the eye. Macula is a central part, and it helps with the tiny little capillaries. So it helps with night vision, and it improves the circulation. Nettle. Nettle also is an anti-inflammatory, and it's a detox. It helps with the whole eye, especially allergies, helps with tissue nourishment. So a lot of times you get the itchy eyes and you get that puffiness under the eyes. So anti-inflammatory, it helps with all that. The bilberry, if I can backtrack for a minute, also helps with eye issues related to diabetes. So I invite you to look into these. What I do is I've been putting all of them together. The nettle is a little bitter, so you might want to add honey to it, which I usually do. I did it in this cup of tea. And what it looks like, the tea itself, is you can see it's got some red. Depends how long you're going to steep it for. That's the goji, and a little bit of a blue hint too, which is the bilberry. Now, I personally have this tea probably every other day. I put them all together because they all help with one aspect of the eye. And the goji berry, especially with the chrysanthemum, is the Chinese and TCM, traditional Chinese medicine, they will refer to that for eye health because it works through the liver meridian, which is connected to the eye. And the others are really more Western herbology herbs. And that's really it. So I'm going to take a sip. It definitely does need honey, but it tastes good. Now, I did another video where you would do acupressure around the eyes. Okay, so I know I'm at a distance from you. If you check out my other video briefly, you would press in the corner. There's a bladder meridian, the very edge of the eyebrow towards the nose. You would press, you would circulate it, rub it a couple times, 9 times. Or you can press in. This is another technique. Breathe in and release it. And do that 3 times or 9 times. In the center of the eyebrow is an extra meridian. We use that one. We use the very end of the eyebrow. And then we use where there's an indentation, like at the temple. We have a gallbladder, we have a bladder meridian. There are a lot of different points, but that's what we would do. And then on the bone, the orbital bone underneath, in the center, there's like a little depression. Be very gentle, be careful you don't go into the eye. Okay? We would use that one, and that's the stomach. When you're done, you're going to keep your head steady and straight and not move it. And you're going to look to the left, look to the right, look up, look down. Go from one corner to the other corner and do the opposite. And then you rotate your eyes around in a circle clockwise 3 times and counterclockwise 3 times. The other thing you're going to do is exercise the eye to go near and far. So if you have eye issues when you're driving, sometimes you have blind spots and it's hard with the peripheral vision to track things. You might want to cover one eye when you're done with that and track your thumb with one eye going around and then going back the other way. And then doing close up and then look in the distance and keep rotating. Look in the distance and then look close up and keep moving the thumb and changing your eye to look in the distance and look close. And you do that with the other eye. When you're done, rub your hands together. You get heat in the palms. And then you cup, or palming they call it, over the eyes. And feel the heat penetrating through the eyes to the back. Now, what I want to share with you is eye health, of course, is drinking lots of water, not smoking, watching your diet, because that has a lot to do with everything. Blood vessels respond to what we eat if it's fatty and fried foods, and we have that blood vessels in the eye. The other thing is, if you want to keep in shape, what do? You lift weights, you might use therapy bands, you might do isometric exercise, Qigong and Tai Chi. You might also do walking, swimming. You're exercising all the joints, muscles, tone, all of that, tendons. So eye health is really important. If we do that for every other part of our body, besides just wearing glasses if you have to, or wearing sunglasses, which is so important to protect our eyes, you want to exercise. You want to exercise the little muscles, the little tendons, the ligaments, everything that actually moves that eyeball around in the socket, that helps you focus where all the light comes in the back of the eye. You want to do all that. And people that lose their central vision, they still have a peripheral vision. So they learn to compensate by using their peripheral vision, maybe turning the head to the side and looking out the vision. So there's still vision. Everything doesn't go black. And I'm talking about macular. Glaucoma, of course, you're losing some peripheral vision, and there's eye drops, and they can put a shunt in. There's no cure for macular, there's just treatment. So regardless, do eat healthy. If you take vitamins, take the vitamins they suggest for eye health. These are herbs that can certainly help, not hurt. Always check with your doctor if you're not sure. And always look up something and come to your own decision. And exercise, especially if you have eye problems. Exercise the eyes. You know, there's an old saying, they say no pain, no gain. I don't like that saying. So there's no gain or moving forward with something unless you pay something to achieve that. So if I want to learn how to play tennis, how to play pickleball, I could learn, I can take some lessons, but I'm not going to be able to play in a league or really play a game with somebody unless I develop my skills. And the only way I'm going to do that is by getting out on the court and practicing and putting the time into it. So by paying to achieve something, it's a matter of putting time into it, or paying for something, as it, works that way too. But I'm talking about putting time into getting more cardiovascular, putting time into building bone strength, walking more, putting the time and effort into looking at what's in the food that we eat and trying to eat healthy, taking the time to go out and buy fresh food, to learn some recipes and cook. If you're just going to grab frozen food or drive-thrus, you're not going to benefit. You're not paying for the benefits of better health. So I hope this helps you and gives you another idea for a good herbal tea for eye health. And I thank you so much for coming to the channel. Do come back and check out the other videos. And thank you once again. Bye-bye.